As a radiographer, you must use age-appropriate methods of communication and execution of the required procedure to deliver safe and quality patient care. Parents or guardians who accompany the child will feel less anxious if they are given proper instructions and explanation of the procedure. Effective communication with the child and parent is key to a successful exam. Introduce yourself to the parent and verify patient identification and confirm the X-ray order. Before bringing the patient into the X-ray room, prepare the equipment and have the image receptors and other immobilization aids ready for positioning. Select the appropriate technique according to the pediatric patient size and have shielding available for the parents and child. The Piggostat is a mechanical immobilizer that is effective for immobilizing a child safely in an upright position in order to obtain quality images. Begin by cleaning and wiping down the Piggostat. Adjust the height of the image receptor holder according to the size of the child. Also, adjust the height of the seat in which the child will be sitting and select the correct plexiglass size of the cylinder sleeves. The correct cylinder sleeve size is very important to avoid movement and positioning errors. Lock the wheels on the Piggostat so that it does not move while positioning the patient. Move and adjust the X-ray tube in the horizontal position and center to the image receptor. Adjust the X-ray tube to obtain 72 inches source to image distance or departmental standard distance. Place the appropriate size image receptor in the holder and lock into place. Place the correct lead marker on the correct side of the patient and collimate for radiation protection and image quality. Place the gonadal shielding next to the Piggostat or use the shielding located on the Piggostat. Go to the console and select the appropriate technical factors for a pediatric chest X-ray. Keep in mind that departmental protocols vary regarding parent participation during image procedures. This is a demonstration with parent participation. Begin giving the parent a lead apron. If the parent is the mother, make sure to ask for possibility of pregnancy. If she is not pregnant, verify her last menstrual period date. Next, assist the parent in removing the child's clothing to avoid any artifacts on the images. Give the parent instructions as to how the child will be seated in the immobilizer. Both the technologist and parent will seat the child in the immobilizer so that the patient is in the posterior-anterior position. The technologist will guide the child's feet as the parent holds the child's arms above his or her head. Once the child is safely seated, the technologist will close the plexiglass supports and lock them into place. Secure the leather strap behind the child's head to immobilize the child. Instruct the parent to stand facing the child's face and have him or her hold the child's hands. At this time, the technologist will make sure that the patient is in true PA, adjust the image receptor, the light collimation, and gonadal shielding on the child. The technologist is now ready for the first exposure. The radiographer must be prepared to initiate the exposure on full inspiration. After the exposure has been made, adjust the technique for a lateral position. Rotate the seat platform base to 90 degrees to obtain a true lateral. Quickly and carefully remove the image receptor and replace it with an unexposed image receptor. Have the parent continue to stand in front of the patient and once again wait for a deep inspiration and expose.